Major depressive disorder is a mood disorder whereby the individual shows 5 or more of the following symptoms, which may be present during the same 2-week period and show a change from previous functioning, with one of these symptoms being either 1. Depressed mood, and 2. Loss of interest or pleasure in doing things. The other symptoms could include depressed mood during the majority of the day and occurring nearly every day. The individual may feel sad, empty, and hopeless, and this may be observable by others around them. Another symptom could include markedly diminished interest or pleasure in doing things almost in all areas of life during most of the day and nearly every day. They may not enjoy or find pleasure in activities or hobbies they enjoyed doing prior to the major depressive disorder. In addition to this, many individuals with major depressive disorder suffer from significant weight loss, unintentionally, or even weight gain. There may be a change in appetite, and they may also either do not get enough sleep or sleep too much. Psychomotor agitation or retardation is also common nearly every day, and the individual may feel tired and feel the excessive sense of worthlessness or excessive or inappropriate guilt. Lastly, many individuals with major depressive disorder also experience a diminished ability to think or concentrate nearly every day, and may even have recurring thoughts of death and try to commit suicide. It is also very important to consider, however, that a diagnosis of major depressive disorder can only be made if the occurrence of the symptoms above is not better explained by schizoaffective disorder, schizophrenia, schizophreniform disorder, delusional disorder, or other specified and unspecified schizophrenia spectrum and other psychotic disorders. It is also important to consider that if these symptoms are a response to a significant loss, such as bereavement, financial ruin, losses from a natural disaster, a serious medical illness or disability, then the diagnosis of major depressive disorder would not be too straightforward, because some of the symptoms that may occur due to significant loss may resemble major depressive disorder, and therefore an exercise of clinical judgment based off the individual's history and the cultural norms for the expression of distress in the context of loss would need to be considered. Now, moving on to the prevalence and causes of major depressive disorder. Major depressive disorder is seen in around 7% of people in US alone, and its prevalence is most common in individuals between the ages of 18 and 29, as the threshold is higher than the prevalence in individuals aged 60 years or older. It is also more common in females. Now, when it comes to the causes of major depressive disorder, some of the causes can include personality, environment, genetics, physiology, and cause modifiers. Personality traits such as neuroticism and negative affectivity can play a role when responding to stressful life events. In addition to that, when it comes to the environment, adverse childhood experiences can increase someone's risk of developing major depressive disorder. One of the major causes of major depressive disorder, however, is genetics and physiology. First-degree family members of individuals with major depressive disorder have an approximate 40% higher chance of also developing it. Not only this, but all major non-mood disorders can also increase the risk of individual developing depression. This may include substance abuse, anxiety, and borderline personality disorder presence. Lastly, major depressive disorder can also be triggered by stressful life events such as job loss, divorce or separation, failing at class, death or illness of a friend or a family member or a loved one, physical or emotional abuse, bullying, social isolation, and financial difficulties. Some of the treatments for major depressive disorder may include medication, talk therapy, or both. Common types of medication may include antidepressants such as serotonin reuptake inhibitors. Some of the talk therapies may include cognitive behavioral therapy, which teaches someone how to deal with negative thoughts and developing problem-solving skills. In addition to this, They may be offered psychotherapy, which may be used to help a person understand issues behind their negative thoughts and feelings. And lastly, support groups may also be used to help people deal with their actual major depressive disorder symptoms. The individual may also be advised to try alternative therapies such as St. John's wort and acupuncture. Regular exercise and healthy eating may also be advised, even though the application of these may be difficult for someone at the very beginning of their treatment course. Lastly, electroconvulsive therapy (ECT) may also be provided for those whose major depressive disorder has become very severe, and for those who have not responded to other treatments offered. It is crucial for anyone experiencing the symptoms above to seek help from a professional who can then best advise the best course of action. It is also important that a family member a family or a friend of someone who has major depressive disorder supports the individual with their best ability by first learning about some of the symptoms of major depressive disorder and encouraging the individual to seek treatment, because many people with major depressive disorder simply do not recognize or acknowledge that they are depressed and may even not be aware of the signs and the symptoms of their depression. They may also think that their feelings are normal, and some people may also feel ashamed about their depression and mistakenly believe that they would overcome it with their willpower alone. However, depression without treatment may become worse, but with the right treatment approach, the person you care about can get better. Some of the things that you can do to help your family member or a friend or someone that you know is by simply talking to them about what you have noticed and why you are concerned. Explaining to them that their depression is a medical condition and not a personal flaw or weakness, and that there is hope with treatment that they will get better. You could always suggest seeking help from a professional such as a medical doctor or a mental health provider. Before this happens, however, you could offer help by preparing a list of questions to discuss in an initial appointment with the healthcare professional. And most importantly, always express and make it clear of your willingness to help the individual by setting up appointments with them, going along with them to the individual appointments. And also, lastly, you could also support your family member or a friend by helping them prepare healthy meals for them, helping them get an appropriate amount of sleep, and to be physically active. But always remember that supporting someone with major depressive disorder can be difficult, and therefore you also need to make sure that you also take care of your own health and needs, and do not let it get the best of you. Thank you so much for watching this video. Please don't forget to leave a like, a comment, and subscribe if you have found this video useful. Thank you for watching, and I will see you next time. Bye.